Hi everyone, in this video we will be discussing about the classifications or levels of nursing theories and the characteristics of nursing theories. So in this video we will be discussing about the classification based on the scope of generalizability, based on the functions and based on philosophical underpinnings and the characteristics of nursing theories. So coming to the first classification, is based on the scope of generalizability. Theories are classified into meta theory, grand theory, middle range theory, practice theory and partial theory. So in that meta theory is the most abstract and the partial theory is less abstract. And we move to each one in detail. Meta theory refers to a theory about a theory. It means it specifies the criteria to be a theory, how a theory should be. That standard is defined by meta theory. So this meta theory addresses the broad issues such as process of generating knowledge and theory development. Next is the grand theory. Grand theories are non-specific, which are comprised of relatively abstract concepts that lack operational definitions. And these grand theories are developed through thoughtful and insightful appraisal of existing ideas as opposed to empirical research. Example is Levinger's theory, Newman's theory or Roger's theory. So it's an example of a grand theory. The grand theory concept of consciousness, which is explained in the Margaret Newman's theory of health as expanding consciousness. So in that theory, the theorist stated a relational proposition about the consciousness. The evolving pattern of person-environment can be viewed as a process of expanding consciousness. So this is a relational proposition which is given in the theory by the theorist about the concept consciousness. Next is the middle range theory. Middle range theories having testable hypothesis. They will have propositions. They are limited in number and these propositions are very specific, and they will be having operational definitions for the concept. And this type of middle-range theories are Orlando's nursing process, Watson's theory, Peplow's interpersonal theory. These are some examples for middle-range theory. So we'll see an example of middle-range theory about the Orlando's theory of deliberative nursing process. In that theory, nurse activity is a concept defined by Orlando, and she gives a proposition that what a nurse says or does is necessarily an outcome of her reaction to something in the situation. So this is a proposition given in Orlando's theory about the nurse's activity. Next is the practice theory. They are least complex theories and they are more specific than middle range theory. They provide specific directions for practice and they are narrow in scope because they explain a small aspect of reality. Examples are like infant bonding theories, oncology, pain management theory are some examples. So these theories are, practice theories are very prescriptive. That means they are limited to a specific population or a field. For example, if you are taking oncology pain management theory, it is applicable to only to that particular group of patients, that is the pain management only in oncology patients. Next is the partial theory. The partial theory is like the picture shown in the screen. There are concepts in the theory is identified and relationships are also identified, but the theory is not complete because some concepts are defined and some are not defined by the theorist. Next is about the classification based on function. So classification is based on functional purposes of four types: descriptive theories or factor isolating theories, explanatory theories or factor relating theories, predictive theories or situation relating theory, and prescriptive theories or situation producing theory. The first one, descriptive theories or factor isolating theories. They describe, observe and name the concept and properties and dimensions of the concept. And this type of theories identifies and describes the major concept of a phenomenon but does not explain how or why the concepts are related. An example is Peplo's interpersonal theory, which is a middle range descriptive theory. In that the concepts analysis are done, but the relationship between the concepts is not clearly defined in this theory. Next is the explanatory theories or fact relating theories. In this type of theory, they relate the concept to one another and they describe the interrelationship among the concepts or proposition. So this type of theories are developed through correlation research. So in correlation research, we are studying the relationship between two variables. So this type of research is developing the explanatory theories. Next is predictive theories or situation relating theories. They are doing prediction of precise relationship between the concept. So this type of theories describe the way in which the changes can take place in a different phenomenon. So example is Orlando's nursing process. So in Orlando's nursing process, if we are doing a proper nursing assessment and we are formulating a proper nursing diagnosis, and if the nursing interventions are based on the nursing diagnosis, the outcome can be predicted in the evaluation phase. So this type of predictive theories are developed by the experimental research. And next is the prescriptive theories or situation producing theories. So this type of theories provide activities which are necessary to reach the defined goal. They address the nursing therapeutics and the consequences of an intervention. An example is Michel's theory of uncertainty. So here in this theory, the theorist says that increasing the coping skills of patients with gynecological cancer assists their ability to deal with the uncertainty of cancer diagnosis and treatment. The third category is the philosophical underpinning. Based on this philosophical underpinning, the theories are classified by Melis in 2011. So based on this philosophical underpinning, we have 4 categories of theory. They are need theory, interaction theory, humanistic theory and outcome theory. So coming to the need theory. Need theory is based around the helping individuals to fulfill their physical and mental needs. An example is Abdullah's theory, Henderson theory, Orum's theory. So criticism about this type of theory is that the patient is an overtly dependent position. So the patient is completely depending upon another person to fulfill the basic needs. Second one is interaction theory. Interaction theory revolves around the relationships nurses forms with the patient. Example is King's theory, Orlando, Peplow, Travelby, Wittenberg. These are the examples for interaction theories. Next is the outcome theory. It portrays nurses as a changing force. They are means nurses direct the patient care who enables the individual to adapt or cope with the ill health. Example is Johnson's behavioral model, Levin's theory and Roy's adaptation model. Next is humanistic theory. Humanistic theory emphasizes a person's capacity for self-actualization, and this theory believes that person contains within himself that potential for healthy and creative growth. Example is Roger's theory. And next is the characteristics of theories. There are mainly 7 characteristics of for a theory. The first one is the theories must have interrelating concepts and it should be explained in such a way as to create a different way of looking at a particular phenomenon. Example is Orum's self-care deficit theory. That in that theory, the self-care is differently explained in 3 aspects. That is a self-care agency, about the self-care deficit, and Orum says about nursing systems. Next is the second character is nursing theories must be logical in nature. It can be inductive, deductive or retroductive. And the third one is theories must be generalizable. That is, it must be applicable to all population, all type of population. And fourth one is basis. Theories are the basis for hypothesis that can be tested, especially the middle range theory. The proposition which is stated can be tested as a hypothesis in research studies. And the fifth one is the theories increases the general body of knowledge within the discipline through the research implemented to validate them. So In case of middle range theory, the propositions are tested by doing the research studies, and that will enhance the general body of knowledge. And sixth one is, these theories are used by the practitioners to guide and improve their practice. Seventh one is, theories are inconsistent with other validated theories, but they leave some unanswered questions that need to be investigated. So, the nursing theories are also, they are inconsistent with the other validated theories, but almost all the theories, they are leaving some unanswered questions which has to be reinvestigated.